Hey guys, it is your Medicare guy, Ken here. We have a very important article to share with you. This came out just yesterday, but it was based on a report from the Kaiser Family Foundation, which is an amazing organization, giving us some really interesting insights into the healthcare space in America in general. This article is from McKnight Senior Living, and they more or less summarized the Kaiser Family Foundation article. So I think this is a great launching point. I will link both this article and the Kaiser Family Foundation article below, but we are talking Medicare Advantage plan denials for prior authorization set record at 3.4 million, which means there were 3.4 million prior authorization denials for Medicare Advantage plans, which is pretty crazy. So let's dive into this article. Medicare Advantage plans denied a record number of requests for prior authorization in 2022, according to KFF analysis on federal data published Thursday. So one of the big issues we run into is it takes a lot of time to gather this data, to process this data, to make inferences about this data. So we're always kind of running 1 or 2 years behind, and then it might take 1 to 4 years for us to make changes. You know, we've seen with the Inflation Reduction Act, this has been a 2 or 3 year period, and there's still things that are going to be happening. So there's a lot of things we need to look out for here. But as of 2022, we saw a record number of prior authorization denials with Medicare Advantage. Medicare Advantage plans denied 3.4 million prior authorization requests for healthcare services in whole or in part in 2022, or 7.4% of the 46.2 million requests submitted on behalf of enrollees that year. So about 1 in 11 requests were denied. That's quite a lot. There are, millions upon millions of people in Medicare Advantage plans. So this is a bit shocking. The share of prior authorization requests denied by MA plans was 5.7% in 2019, 5.6% in 2020, and 5.8% in 2021. So we saw like a little bit actually went down. It was about the same for a very long time, and then all of a sudden a big 2% jump, which, is pretty crazy to see. One reason for the increase in denials could be the increase in MA enrollment in recent years, the authors said. Between 2019 and 2022, they said the number of enrollees in MA plans increased from 22 million to 28 million. Now, this number as of 2024 is believed to be about 34 million. So this is only going to go up, but we have to talk about how not only the volume went up, but as you can see, the percentage went up as well. So we're seeing a trend both in the amount of people in Medicare Advantage plans and the people who are seeing denials. Some lawmakers and others have raised concerns that prior authorization requirements and processes, including the use of artificial intelligence to review requests, impose barriers and delays to receiving necessary care. Jeannie Fugleston-Beniak, I always mess up names, I apologize, Nolan Soronsky, and Tricia Newman wrote for KFF. This was a big thing earlier in the year and last year that certain insurance carriers were apparently using one doctor to use an AI program, and that doctor was denying tens of thousands of claims a day, which is obviously impossible if it was just one doctor looking through every prior authorization request. So again, a concerning thing to look at. This is all whistleblower accounts. So if you ever want to dive into it, there are plenty of articles about it. I can link one below. Just 9.9% of prior authorization requests that were denied were appealed in 2022. The authors opined that the low rate of appeals could stem from MA members not knowing that they can appeal a decision or finding the appeal process intimidating. Most people, once there's a denial, do not fight it. We have had to fight with our clients for denials, and sometimes it's Medicare Advantage, sometimes it is original Medicare where there's like a billing issue or something like that. When you talk to people in the space, they in many cases say it's a coding error, which is why these authorizations are denied, but a lot of people just give up. It can be tough to get someone on the phone. It can be tough to get someone on the phone that knows what they're talking about. So even though there is an appeals process, as they pointed out here, not a lot of people know it exists. And even if it does exist, it can be cumbersome. It can be tough to get through. It can be tough to find the right person to help you for your needs. A final rule announced by the Centers for Medicare and Medicaid Services in April revised the appeals process for Medicare Advantage beneficiaries who have been denied coverage. The rule should be a significant help for both beneficiaries and long-term care providers, sector leaders said at the time. So this is an article from a little bit earlier in the year. We're filming this in August 2024. This came out April 2024. So Medicare Advantage rule finalizes independent appeals process, helping providers stuck in the middle. So this is a very interesting development, and I looked it up on the Federal Register. These changes should go into effect January 1st, 2025 if they all go through. So just so you know, that is the end goal with this final rule. A final rule announced by the Centers for Medicare and Medicaid Services Thursday revised the appeals process for Medicare Advantage beneficiaries who had been denied coverage. The new rule should be a significant help for both beneficiaries and long-term care providers, sector leaders said Friday. The changes are in line with the rule proposed in November and would bring MA appeals more into line with traditional Medicare. So there's different processes, and we see, the occasional denial or issue. When we're dealing with original Medicare, we find a lot of times when there's denial, it is a coding issue on the doctor's part. And when we talk to Medicare Advantage providers, they pretty much mirror the same thing. They say you might see these prior authorization numbers, these denials, everything like that, but it's usually due to a coding issue. So this is basically saying we're going to have an independent review to take care of these things. Beneficiaries denied MA coverage will no longer be required to shoulder the cost of their treatment if they do not appeal quickly enough and their appeal is unsuccessful. That old status quo has been a significant barrier to appeals, according to Nicole Fallon, Vice President of Integrated Services and Managed Care at Leading Age. MA plan enrollees whose appeal is unsuccessful must currently pay privately for any services received after the date the plan terminated services, Fallon explained Friday. Therefore, enrollees are often reluctant to appeal due to the financial consequences. So a lot of people are more rolling the dice with the devil they know as opposed to appealing and potentially getting a bigger bill. So I think that's why a lot of people are scared to do this. And just like we talked about in the previous article in this video, a lot of people just don't know they can even appeal. We're looking at 11% appeal rate with these denials, and a lot of people either don't know they can or don't know how. So this might help bridge the gap. While MA denial of coverage appeals have a high success rate, more than 80%, this is huge. We did not know that 80% of people get through appeals. Only 11% of denials were appealed previously. More than half of Medicare beneficiaries now use MA plans. So this is big. There are a lot of articles about prior authorizations and people frustrated with denials and everything. 80% success rate is huge. And if we're outsourcing this to an independent agency, hopefully it can be even higher, and more than 11% of denials will be appealed. Independent review. Crucially, the final CMS rule makes fast track appeals subject to independent reviews by a quality improvement organization rather than by the MA plans themselves. It also removes a former provision requiring beneficiaries to forfeit their right to an appeal when they leave a facility. We did not know about this. That's crazy. I did not know that once you leave a facility, you cannot appeal. That is absurd. I'm glad they're changing it. But I honestly think insurance carriers are going to like the fact that an independent company is reviewing it too, because they're catching potentially a lot of flack for these denials. If an independent reviewer is looking through it, they don't have to burden the administrative costs of dealing with all these authorizations and denials, but they can kind of say, hey, this is based on the laws and regulations from an independent review. This isn't us. Those changes should be a huge help for providers stuck in the middle of beneficiaries upset at losing their coverage and MA plans that are denying them funding, according to Maureen McCarthy, president and CEO of Celtic Consulting. I'm hoping this can really level the playing field for providers, she told McKnight's Long-Term Care News Friday. The new process should be helpful to providers so that they can get in and have an independent review of denied care rather than going back to the insurance company. Because if they're not following the rules in the first place when it comes to coverage, what makes you think they're going to overturn that? So we've seen anecdotally articles about hospital systems dropping certain insurance carriers or, certain types of plans and that kind of thing. So again, I think this would open networks up, because rather than doctors being frustrated with a specific insurance company, everything can get outsourced to a third party, and that might help mend some bridges across the entire spectrum. Providers have seen themselves as victims as average MA saturation cleared 51% for the first time last year, with it surely en route to even higher levels. The plans have winched down average lengths of stay, while in many cases also tightening payouts and prior authorizations. So, again, we've seen articles where certain hospital systems have dropped certain Medicare Advantage plans. Certain doctors' offices have said we're not rolling with certain Medicare Advantage plans. It kind of depends on your region, your area. So this isn't one size fits all, but we've definitely seen some issues anecdotally with the articles we've seen over the years. McCarthy said that the ability to escalate appeals to administrative law judge will be vital for providers and beneficiaries looking to reinstate coverage moving forward, especially in cases of post-payment denials when care has already been delivered before payment is denied. Where there had previously been no recourse for providers looking at a minimum of heavily delayed payments, there's now a much higher chance for reinstatement if providers can make their case well. You need an independent review. I agree, McCarthy said. And I think that's where providers are going to have the best outcome when they get to the administrative law judge level and they're able to show the judge the actual regulation that governs the area. So I think an independent review is a win for everybody. I think it's a win for patients who might not be able to fully grasp how to do an appeal through an insurance company. I think insurance companies are going to like not having to bear the administrative burden of all these prior authorizations and denials. And I think providers are going to like it because there's just more transparency as to what is covered and what they are actually able to give their clients and, you know, who they can play ball with. So do you like these changes to the Medicare Advantage system? Have you had any great experiences or bad experiences with Medicare Advantage? Have you been on both Medicare Advantage and Original Medicare? You know, which one do you like more? We'd love to know your thoughts. We are not here to give any bias. We're just here to give information that we're coming across that we think is relevant to our audience and to our clients. So yeah, it is really up to your personal preference, but we always like to keep you guys up to date with these developments. So please give us a comment, like, share if you think somebody would like this video. And if you need any help with your Medicare or life insurance, please reach out to NJ Life and Health. We are licensed in about 25 states currently. Our bread and butter is New Jersey, but we obviously love to help people in Pennsylvania, New York, Florida, the Carolinas, Georgia, all over the place. And we have a bunch of other great videos where we not only go through Medicare specifics, but also reacting to news like this, giving you an expert insight into the world of Medicare. So thanks again, and we will see you in the next video.